Hello, I'm Dr. Robert Valente, board-certified rheumatologist at the Arthritis Center of Nebraska. I'm particularly interested in systemic lupus erythematosus, an autoimmune disease that occurs when the body's tissues are attacked by their own immune system. Systemic lupus erythematosus is also known as the Great Mimic. This disease can affect almost any organ in the body, not just the joints. Because it affects so many different parts of the body, it can be confused with other diseases. I am pleased you have joined me to learn more about systemic lupus erythematosus. The name systemic lupus erythematosus comes from the characteristic rash that occurs across the cheek and the bridge of the nose. The name lupus comes from the rash that mimics the facial pattern of the wolf. The rash is red, hence the term erythematosus, and since the disease is more than skin deep, we use the term systemic. Sometimes we abbreviate this and call it SLE or lupus. When lupus occurs as a skin-deep condition only, it is called cutaneous lupus erythematosus. The skin rash looks the same, whether it is cutaneous or systemic disease, but there is no internal organ involvement or joint involvement in skin-deep lupus. Systemic lupus erythematosus, or SLE, is a relatively rare disease. SLE affects about 290,000 people in the United States, which translates into about 1 in 1,000 white women. SLE can cause arthritis and inflammation in the lining of the lungs, heart, blood vessels, and nerves. Joint disease and skin rash are the most common features of systemic lupus erythematosus, but internal organ involvement is also a concern in up to 60% of individuals with SLE. Up to 15% of patients with SLE will have some inflammation that affects the brain, and this can include symptoms of psychosis, depression, stroke, or even dementia. SLE is a complex disease, and it is also complicated to explain what causes it. There is clearly a genetic component, but it is not inherited in the same way that you inherit blue eyes or curly hair. These genes increase immune system reactivity with antibodies that you make that clump your own DNA together, producing large molecules called immune complexes. Immune complexes then will deposit on the surface of blood vessel walls in joints and internal organs like the lungs and kidneys, and this will stimulate an immune reaction that damages tissues. Sun exposure, tobacco use, all enhance the formation of immune complexes. It's interesting that there are many more young women than men with SLE. There is also more SLE in blacks, Asians, and individuals who come from lower economic strata. The genetic influence on SLE is complex, as twin studies have shown. If twins are identical and one has SLE, the other twin has a 25 to 50% chance of getting SLE too. If the twins are just fraternal, however, that risk of both having lupus falls to just 5%. Even if you do not have a close relative with systemic lupus erythematosus, there may be a higher risk of autoimmunity running in the family that can include thyroid disease, diabetes, or rheumatoid arthritis. Discoid lupus skin rashes are red, raised, and aggravated by sun exposure. They will frequently scar, and when they occur on the scalp, it can be associated with permanent hair loss or alopecia. It is much harder to control discoid lupus in patients who continue to smoke. Additional lupus rashes include non-scarring reversible hair loss, or a malar rash across the bridge of the nose and cheeks, which does not scar. Sometimes we can see a very diffuse red rash with sun exposure. This is also known as photodermatitis. The arthritis associated with SLE is a small joint symmetric arthritis that absolutely loves the middle row of knuckles. A variety of eye troubles occur, from simple eye dryness, which can be quite disabling, to inflammation of the eye that could threaten your vision. Mouth sores, mouth dryness, and blisters all occur as complications of SLE. These are pictures of Raynaud's phenomenon, and on the right we see classic white attacks where the fingers turn white with exposure to cold. White attacks represent a complete lack of blood flow and indicate tissue damage is occurring. When blood vessels become inflamed, they can clot off, and the tissues that are fed by those blood vessels will die. This is called vasculitis, and it can be life-threatening in SLE. Treatment for skin-deep lupus and the rash associated with SLE starts with sun avoidance and the discontinuation of tobacco. A variety of topical creams can help with skin inflammation, and if the rash remains difficult to manage, oral medications can be helpful. The treatment of SLE has not changed much in the last 40 years. It includes anti-inflammatory therapy like aspirin and corticosteroids like prednisone. Immunomodulators and immunosuppressive therapies like hydroxychloroquine, azathioprine, methotrexate, and more recently mycophenolate are used for systemic lupus erythematosus. Life-threatening systemic lupus erythematosus may require chemotherapy drugs like cyclophosphamide. Today, the diagnosis of SLE rarely means a life-threatening problem, and usually is a mild systemic inflammation that is quite compatible with a normal life. Thank you for taking time to learn more about systemic lupus erythematosus. Our team of Mayo Clinic trained and board certified rheumatologists at the Arthritis Center of Nebraska consider it a privilege to help people with arthritis and autoimmune diseases. We invite you to call 402-420-1212 for more information or to schedule an appointment. Thank you.